So I'm going to spend some time going over the post-operative instructions following your knee surgery. When you arrive home, make sure you find a comfortable place to rest. The next several days are a period of rest and are not the times to be scheduling flea market trips or trips to Kings Island. When you get home, apply the cold therapy device as instructed at your pre-op visit. Take your pain medicine as directed and any other medications that you have been prescribed. Try to find a comfortable place to rest so you can elevate your leg. Elevate the affected extremity on the LRU pillow or stacked pillows as shown here. You may eat whatever foods sound good, but I would recommend starting slow. If you've been written for an antibiotic, take this as directed. On the day following your surgery, make sure that you continue your cold therapy as instructed. If you are using ice packs, you will want to apply this for 20 minutes every 2 hours. Avoid placing the ice packs or the cold therapy pad directly on your skin. You may be up on your crutches, but you should place no more than half or 50% of your weight on the affected extremity. Again, continue to take your pain medications as directed. You may begin an over-the-counter anti-inflammatory, such as ibuprofen, if you have no medical contraindications. If you are not sure about this, contact your primary care physician for some advice. We want you to begin your home exercise program by beginning the drop and dangle and hanging knee exercises listed at the end of this. You may find this a bit difficult while you still have your surgical dressing on. If so, you may delay starting these exercises until day 2. If you have been given a CPM, and not everyone will be, you should start this on day 1 as instructed. Make sure that you're alternating between the CPM and the LRU pillow about every 3 to 4 hours. If you have been given a brace, continue to wear this when you are up and walking and keep the brace locked in full extension. On day 2, you may remove your post-operative dressing. You may notice some blood on the dressing, but this is not abnormal. Apply Band-Aids to your incision. At this time, apply the extra white stocking or TED hose to the surgical side. This helps to control swelling and may lower your risk of developing a blood clot after your surgery. Again, continue to take your pain medication as needed. If you have been given a muscle stim unit, you will start this today. Continue to alternate between the CPM and the LRU pillow as noted above. Remain on your crutches and continue to adhere to the weight-bearing restrictions noted previously. The good news is that you may shower today after you complete your dressing change. Keep your incisions covered. We recommend that you use a shower seat and make efforts to keep your incisions out of the direct spray of the water. I want you to avoid tub baths, swimming pools, and hot tubs at this point. Again, continue your home exercise program, and now you've reached day 3. At this point, unless otherwise indicated, continue to follow the instructions as outlined on day 1 and day 2. Now let's go over the home exercise program briefly. Some recommendations for leg elevation. Keeping your leg straight as you elevate your leg above your heart level. The LRU or leg raiser upper pillow is an option and can be made available to you at your pre-op appointment. It is important that you avoid placing pillows behind your knee, as this can contribute to motion problems down the road. With regard to the home exercise program, do these slowly. We want you to do these 3 times a day, and you should spend about 10 or 15 minutes on the exercises combined. With regard to the drop and dangle, start with your operative leg extended or straight. Support your leg using the non-operative leg. Slowly lower your surgical limb by bending at the knee. Make an effort to keep your body weight over the hip on the side of the surgery. Bend as far as you can. A little soreness is expected. Hold it in that position for 5 or 10 seconds and slowly bring your leg back to full extension or straight. Use your good leg to assist you in raising it back up. Once your knee is straight, contract your thigh muscle or your quadriceps for about a 5-second count. Rest for 5 or 10 seconds and repeat the exercise. Again, perform this exercise about 10 times every 2 to 3 hours while awake. The hanging knee exercise works on getting your knee straight and keeping it there. Lie on a couch or the floor and get assistance if you need help getting up and down. Prop your foot and ankle on a foam roll or a large stack of towels, raising your heel approximately 8 to 10 inches off the ground. Allow your knee to come to full extension or straight. Contract your thigh muscle as you attempt to push your knee into the floor or couch. Hold this contraction for 10 seconds. Rest for 10 to 20 seconds, and again repeat this exercise 10 times every 2 to 3 hours while awake. Now let's go over some frequently asked questions that I'm sure you have. What about driving? Well, if the surgery is on your left knee and you drive an automatic vehicle, you may drive once you are off the narcotic pain medication. Otherwise, we will discuss driving when you return for your first office visit. You are still considered an impaired driver. Now you're asking, do I really need this cold compression unit? Well, of all the items recommended, this is the one that we receive the most positive feedback on. Recent literature supports a significant decrease in the need for narcotic pain medication when both cold and compression are used together. In addition, studies support a significant decrease in post-surgical swelling complications. We do recognize that most insurance plans do not cover the cost of this device. However, decreased pain and decreased swelling will have a positive impact on your post-operative recovery. The next thing you're wondering is, how much pain should I expect? Well, every patient responds differently to the trauma of surgery. No surgery is likely to be pain-free. The truth is, surgery hurts. Begin your pain medication as instructed. Generally, your pain will begin to subside by the 3rd or 4th day post-surgery. Augmenting your narcotics with an over-the-counter anti-inflammatory is often helpful. So you had a nerve block and you're wondering what to expect from that. The pre-op nerve blocks provide something that we call preemptive analgesia. In short, there is a theory that by blocking the pain beforehand, you may decrease the pain that follows. The good news is that you will typically leave the surgery center with little or no discomfort. The bad news is that all good things typically come to an end. The effect of the block will predictably wear off somewhere between 6 and 24 hours. If you do not stay ahead of this, the wearing off can appear very abrupt and sudden. One way to avoid this is to begin taking your prescribed pain medication before you begin to feel the effects of the nerve block wearing off. Will you need someone with you after the surgery? Well, everyone will have a different need when they get home. We do recommend that you have someone with you for the first 24 hours and until the effects of the anesthesia have worn off. If you feel that you would benefit from additional home health services, please let us know and we will arrange an appointment for you with our home health care provider. Now, what kind of clothes should I wear after my surgery? Most patients start to feel better once they begin to get back into their normal routine. We encourage you to get out of your pajamas and into comfortable clothes as soon as possible. Well, what about returning to work or school? Well, this is an important question and will vary dependent on the surgery that you had and your job and or school requirements. We encourage you to take it easy for the first 7 to 10 days to allow your body to recover from the trauma of the surgery. This is not the best time, as mentioned before, to plan trips to the flea market or Kings Island. Will you need formal physical therapy after the surgery? Functional recovery from your operation requires many things, all coming together at the same time. A short period of formal physical therapy is typically recommended to assist you with minimizing your swelling, improving your range of motion, and facilitating your return to normal activities. We will attempt to schedule this appointment at your preoperative visit. Please let us know if there is a specific therapy location that you prefer. Now here's my story of a stilt walker. I met a stilt walker who broke his stilt. He got out a can of glue to repair his stilt. The glue box said to wait 8 days for him to walk on his repaired stilt. He asked me if I thought it would be safe for him to walk on this at 3 days. I said, the box says 8 weeks. Why would you do this in 3 days? Didn't make sense to me. The same thing goes with some of the surgical healing that takes place. You have to respect the biology and understand that some of these tissues take 8 to 12 weeks to heal or before the glue actually sets. So be respectful of the biology as you move along the rehab process. If you have any questions about your follow-up appointment, please call the office to verify this. This should be sometime in the next week. If you have any additional questions, please call the office at 832-4773.